Helping your child break irritating habits, nail biting, thumb sucking and chewing. Welcome, dear parents, to our parenting knowledge sharing section. Today, we will explore some common habits in young children such as thumb sucking, chewing on clothes, or nail biting, behaviors that often cause concern and confusion among parents. Before diving into each issue, it's important to understand that many of these behaviors, like thumb sucking, are natural reflexes from infancy that help children self-soothe. However, if these habits persist over time, they can impact a child's oral health, emotional development, and daily routines. Similarly, habits like chewing on clothes or biting nails often stem from a need for sensory input, emotional relief, or simply become habits formed during development. What matters most is for parents to correctly identify the underlying causes, understand the potential impacts, and apply appropriate, patient interventions while supporting their child. So, let's take a closer look at each habit. When your child sucks their thumb, understand to help them gently let go. Many parents with young children have seen their little ones suck on their fingers, right? While this is a fairly common behavior, it can also bring certain worries. So, what should we know about this habit? The origin of thumb sucking. Experts say that all infants are born with a natural sucking reflex. Thumb sucking, especially the thumb, is very common among infants and toddlers. This reflex not only helps calm them when they're upset but also serves as a way for them to self-soothe and find balance during their development. In fact, many babies start this habit even before birth. Undesirable effects of prolonged thumb sucking. If thumb sucking continues for too long, it may negatively impact a child's oral and jaw development. Continuous pressure on the soft tissues of the upper and lower jaws can narrow the upper jaw, leading to a misaligned bite when the jaws close. Prolonged thumb sucking can affect teeth alignment, hinder the development of the upper jaw, and create a gap between the upper and lower front teeth. The severity of these effects depends on the frequency, intensity, and duration of the habit. Fortunately, these changes are often temporary and rarely cause long-term damage if the habit stops by around age 3 or 4. Additionally, the skin around the fingers may become irritated, forming calluses or cracks. A 2016 study in the Journal of Dentistry also linked finger calluses from thumb sucking to misaligned bites. Moreover, the habit may affect a child's speech development, pushing the upper jaw outward and causing protruding or misaligned front teeth. Does thumb sucking go away on its own? The good news is that many infants naturally stop sucking their thumbs around 6 to 7 months old. However, if your child continues this habit into toddlerhood and preschool years, it's time to consider helping them quit. Most pediatricians and dentists agree that children should stop thumb sucking between ages 3 and 4. Some experts recommend earlier intervention. Every child is unique, though, with different coping skills and levels of understanding. For many kids, the urge to suck their thumb fades as they grow. For others, it becomes a persistent habit, especially when they're seeking comfort or falling asleep. If thumb sucking serves as a coping mechanism, children often develop alternative habits between ages 2 and 4. Tips for helping your child quit thumb sucking. How can you help your child stop thumb sucking gently and effectively? Here are some helpful suggestions. Start slowly. Children need time to give up this habit. When you notice signs that your child is ready, be there to support their efforts. You can create a safe zone at home, like their bed, where they're allowed to suck their thumb if needed, while setting limits in other areas. Offer plenty of praise. Constant criticism or drawing too much attention to the behavior may backfire. Instead, focus on encouraging moments when your child doesn't suck their thumb. Small rewards like stickers or an extra bedtime story can be motivating. You might also use a reward chart with stars for days they go without thumb sucking. Try substitute activities. If you notice your child about to suck their thumb, gently redirect them with toys or favorite activities. If boredom seems to be the trigger, encourage hands-on tasks like coloring, clay modeling, drawing, anything that keeps their hands busy. Teach new coping strategies. Sometimes, children suck their thumbs to deal with fear, anxiety, or sadness. Teaching them simple techniques, like deep breathing, can not only soothe their emotions but also replace the need to suck their thumb. And finally, know when to seek professional help. Harsh methods like applying bitter-tasting substances to fingers can make children feel uncomfortable or ashamed. Don't pressure your child if they're not ready to quit. However, thumb sucking shouldn't persist indefinitely. If your child is 5 or older and still sucks their thumb, speak with a pediatrician or dentist. They can provide useful advice and assess your child's specific situation. When your child chews their clothes, decode the behavior and respond effectively. Besides thumb sucking, some children develop the habit of chewing on their clothes. Why does this happen? And what can parents do? Let's explore the causes and solutions. Why do children chew on their clothes? There are several reasons behind this behavior. First, according to Sigmund Freud's theory of psychosexual development, children aged 0 to 1 are in the oral stage, where they tend to explore the world through their mouths, especially when teething. Oral stimulation plays a vital role in development. Second, children may seek oral input to self-regulate or self-soothe, similar to breastfeeding, using a pacifier, or thumb sucking. Therapists suggest that chewing on clothes may fulfill a sensory need. Children seek comfort through oral stimulation. Clothes are readily available, and chewing helps them feel calm. Third, this habit may signal anxiety, ADHD, or other developmental concerns. If the behavior is persistent and difficult to manage, it's wise to consult a doctor during routine checkups. How chewing clothes affects daily life. If the habit interferes with daily activities or raises safety concerns, timely intervention is needed. For instance, frequent chewing may damage school uniforms or, worse, lead to choking hazards if the child swallows fabric. In such cases, seeking help from a therapist is advisable. Talking to your child, the crucial first step. When you notice your child chewing on clothes, begin with an open, non-judgmental conversation. Try to find out whether they are aware of the behavior. You might ask, "I have noticed you sometimes chew on your collar. What do you think about that? Does it help you in any way?" If your child is aware, you can ask how they feel when doing it in front of friends, or whether any classmates have the same habit. These questions help you assess the social impact of the behavior. Most importantly, avoid shame or blame. Ensure your child feels safe talking to you. Ways to help your child stop chewing clothes. To help your child reduce or stop chewing clothes, you can try these strategies. Identify specific triggers. If your child tends to chew when hungry, have healthy snacks readily available. If the behavior is linked to anxiety, teach simple stress relief techniques such as deep breathing or gentle physical activity. Offer safe alternatives. If your child seeks oral stimulation, give them specialized chewable items such as soft chewable necklaces or therapeutic chew tools. Keep their hands busy. This reduces the chance of them bringing clothes to their mouth reflexively. Encourage activities like coloring, playing with clay, or building blocks. Anything engaging that uses their hands. Don't hesitate to consult a professional. Talk to your pediatrician for a comprehensive evaluation. This may include checking your child's nutrition, especially if they struggle with chewing food. Attention span, social interaction, language development history, or signs of anxiety. After identifying the root causes, specialists can provide tailored support to help your child gradually overcome and eventually eliminate this habit. When your child bites their nails, patiently supporting them through the habit. Another common habit that often worries parents is nail biting. Most children eventually grow out of it on their own. But if the habit persists or becomes difficult to tolerate, there are still simple ways to help your child. Why do children bite their nails? If your child bites their nails, they're definitely not alone. About half of children aged 10 to 18 bite their nails from time to time. And for many, the habit begins even earlier. Nail biting is part of a group of nervous habits, which may also include hair twirling, nose picking, or thumb sucking. More specifically, nail biting is a repetitive behavior focused on the body. Some children bite their nails when they feel restless or uneasy. Others do it when they're anxious and don't know how to cope. Nail biting can be a way for children to self-soothe. While it can be unpleasant to witness, and potentially harmful to your child's teeth and nails, most cases of nail biting don't pose serious health risks or indicate deeper issues. However, if your child bites their nails very intensely or causes damage, it's a good idea to consult a pediatric dentist. In most situations, nail biting is simply a habit formed during anxious moments, although it often causes frustration for parents. Ways to help your child stop nail biting. So how can you help your child break the habit? Here are a few suggestions. Sometimes, ignoring it helps. Many children eventually stop nail biting on their own. So some parents find the best strategy is simply not giving it too much attention. However, this can be difficult for others to do. Observe and identify the cause. If the nail biting suddenly appears, consider whether your child might be feeling anxious or under pressure. Remember, even positive events, like an upcoming trip or a new toy, can make children feel nervous or overstimulated. If the habit becomes frequent, try the following. Keep your child's nails trimmed. Regularly trimming nails helps reduce exposure to dirt and bacteria and makes the nails less tempting to bite. Also, take care of the cuticles to prevent infection through broken skin. Provide a safe alternative. Offer something safe for your child to chew or fidget with. For older children, you could provide crunchy snacks. Just be sure to avoid sugary options to prevent one bad habit from replacing another. Keep their hands busy. Find activities that keep your child's hands engaged, such as squeezing a ball, playing with clay, slime, or textured items. This distracts them from the urge to bite. Create a subtle signal. Develop a discreet cue just between you and your child. For example, gently touching their hand or using a secret code word can remind them without embarrassing them in front of others. This helps raise their awareness of the habit, which is often done unconsciously. Encourage with rewards. Use a sticker chart. For each day your child doesn't bite their nails, they get a sticker. You can break this into smaller time blocks, like before breakfast or after dinner, to make it easier at first. Once your child collects a certain number of stickers, reward them with something meaningful, like a trip to the park after earning 5 stickers. Let natural consequences teach. Sometimes, mild discomfort, like pain from biting too close to the skin, can help children realize the negative effect of the habit and motivate them to stop. Avoid making things worse. It's important to remember that giving too much attention to a bad habit can backfire and even intensify the behavior. Harsh punishment or mocking your child is never an effective way to bring change. Our goal is to help our children manage their nail-biting habit, not to demand that they stop immediately. Long lectures about hygiene usually don't work either. Instead, occasionally bring up the topic with gentle, open-ended questions like, "I've noticed you've been biting your nails more lately. Do any of your classmates ever notice?" This may help your child become more self-aware about how they appear to others. Similarly, you could say, "Sometimes your fingers look sore from biting. Does it ever hurt? Do you wish you hadn't done it?" If your child expresses a desire to stop, help them make a concrete plan. They might even suggest a reward for letting their nails grow long enough for trimming, instead of chewing them off. Be patient with your child. The process of breaking the nail-biting habit can be full of ups and downs, which is completely normal when trying to overcome any deeply ingrained behavior. However, with consistent support from parents and effort from the child, the habit will likely fade over time. Remember, giving up a bad habit is tough, even for adults. If your child feels frustrated with themselves for not stopping, encourage them and reassure them that you're on this journey together. And most importantly, remind yourself that this is just a passing phase many children go through, especially when you're feeling particularly annoyed. Dear parents, we hope this article has provided helpful insights to support your child in overcoming unwanted habits. Above all, love, patience, and understanding from you are what matter most. We wish you and your children continued health and happiness.